Hello everyone, welcome back to my channel. If you are new here, I'm happy you are here. I'm your favorite nurse, Aren Jongwa. In this channel, we talk about health, wellness, and when you should take informed decisions and know when to see your healthcare provider. In today's topic, we'll be talking about 5 subtle signs that talks about endometriosis and PCOS. And in today's video, the topic we are discussing affects millions of women worldwide. So, if you want to get to know more about this topic, grab your seats, bring your pen, and sit down and let's get started. So, like I said, we'll be talking about topic that affects millions of women worldwide. Most of these days, when women are having cramps, severe cramps, they'll be telling their fellow women, I'm having cramps, so I'm having severe cramps, and this cramps does not go away, even when I've taken pain relief medications, even when I've taken warm water, it does not go away. And they'll tell you, it's a normal thing as a woman for you to have cramps. That some people even tell you when you give birth that it will go away. No, that's a fallacy. Don't agree to that. So, without wasting much of your time, let's get started. Now, I'll be differentiating between PCOS and endometriosis. Now, PCOS is a hormonal imbalance and it affects how the ovaries work. It affects the ovaries entirely. It causes irregular menstruation, weight gain, growth of excess hairs, and most of the time, weight loss. Why endometriosis on its own is a structural disorder. What do I mean by that? Endometriosis happens when similar lines of the uterine lining grows outside of the uterus, and it will be causing pain, inflammation, and all the rests. Now, let's get started. The first point, sorry if you see me looking at my jotter, know that I'm trying to locate some of the points so that I will not forget anyone. Now, the first point on my list here is severe bloating. As we all know, we women, we are usually bloated during or before our menstrual cycle. Now, when this bloating is now so severe that you feel as if you have bottle of gases in your stomach, you can't even touch your stomach, you feel so much pain, and your stomach is now protruded as if someone that is 5 months pregnant, please do not pay deaf ear to such signs and symptoms. It's high time you need to seek for your medical advice. It's high time you need to seek the advice of your medical practitioner. The second point here is stubborn acne and extra hair growth. Yes, and this stubborn acne, they usually grow around the jawline here, and this acne, you've used your money to buy the whole skincare, you've buy loads and loads and loads of skincare, Korean skincare, to name but a few, but it's not going away. My dear sister, it's high time you should start internally to treat this acne, and it's high time you seek the advice of your medical practitioner. Now, for the extra hair growth, most women sometimes they begin to grow beards, mustache. They begin to grow hairs on their chest, and they begin to grow hairs on their stomach, which shouldn't be. This is as a result of high production of male sex hormone in their body, which is known as androgen. So once you notice these things, stubborn acne and extra growth of hair, it's high time you seek for the advice of your medical practitioner. The next point here is pain during everyday activities. Now, if you're having pain during your everyday activities and you be like, it's normal, please, it is not normal. It shouldn't be. Or you are experiencing pain during sexual intercourse between you and your partner, please, that shouldn't be. That is as a result of inflammation or infection of the abdominal cavities like the pelvic, the bowel, and the bladder. And if you can't carry out activities of daily living when you're on your period, please, that is not something you should look away from. That is not something you should tag as a normal thing. It is high time for you to seek the attention of your medical provider. Now, another one is irregular or missed period. Most women have irregular or missed period, and yes, PCOS and endometriosis causes irregular or missed period. Irregular period is you saw your period on January and you are seeing it again in April. You saw it in April and you are seeing it again by October. No. Now, missed period is the one that you usually see your period by 29th of every month now is now coming by 10th of every month. Being missed, being irregular, it will affect your ovulation. You will not be able to track your ovulation, and this sometimes is one of the causes of infertility we are having. So if you're having irregular or missed period, please don't pay a deaf ear to that. It's high time you see your healthcare provider. Now, the last but not the least on my jotter here is heavy bleeding and extreme tiredness. There are some people that when they are having their period, they are changing pad every 10 minutes, every 20 minutes. Are you the type that every 1 hour, every 55 minutes, you're always changing your pad? Because it's not good. You are having a large amount of clots instead of the normal clots you should have. That is not good. Low level, when there is heavy bleeding, there is low level of iron in the body, and when there is low level of iron, anemia sets in, and when anemia sets in, it causes that extreme tiredness and weakness you are having. Now, if you have watched this video to this moment, do not panic. The purpose of this video is for me to call your attention to those signs you've been ignoring in the past. It is high time you go and see your doctor or medical practitioner for these signs. And I want to call the attention of women to something. As a woman, starting from today, please start paying keen attention to the signs and symptoms your body is giving you. Track your signs and symptoms. You can use calendar or you can use Flow app to track your signs and symptoms. When you track your signs and symptoms, when you go to the health facility, you will be able to give your doctor or your medical practitioner the accurate health history they are looking for. It's not when they ask you, when last did you see your period, you'll be like, I think is not the best thing you should do when you should start tracking your signs and symptoms. Please, from today, start tracking your signs and symptoms. And another thing I'm calling your attention to is this. Always pay attention to your body. Always visit the health care facility. Do not take matters into your hands or start listening to philosophies they are telling you is normal thing. With time, it will go out. And if you've had any of these signs and symptoms of endometriosis or PCOS, please comment down below. Let me know, because I'll be reading the comment section to reply most of the comments. And if you also watched this video to this moment, thank you so much for being with me till this hour. Thank you. Please don't forget to subscribe, like, turn on the notification bell so that anytime I post a video, you'll be the first person to get notified. And please don't forget to share this video to your family and friends so that they will also learn one or two from here. Thank you. See you in my next video. Take good care of your health. Remember, health is wealth. Love you all. Remain blessed. Bye.